So much, Tyler. February is American Heart Month, so today we're going to talk all about heart health.
That's right. Nurse Christina Paris from the VA is here this morning to tell us more. So good morning, Nurse Christina. Thanks for being here today.
Always a pleasure.
Absolutely, we love having you. So first of all, obviously, family health history is such an important factor for cardiovascular disease. So what exactly is the disease and how does your family health history play into it?
So the heart, it works a lot like the engine in our car. So when we're looking at the heart and we're looking at problems, we look at structural problems. We look at plumbing issues or electrical issues. So pretty simple to break it down that way. So when we're diagnosing the heart, we diagnose it similar to when you're diagnosing a car too. So we listen for kind of clicks and whines. That's what we use our stethoscope for. We're listening to the heart. We connect you to different machines. That's what the EKG does when we connect them to that. Then we kind of rev up the engine, you know, to see what happens, and that's a stress test. So we do that too. And lastly, we look under the hood. So we can do different ultrasounds or angiograms to kind of see what's going on with the heart. So when we're talking about cardiovascular disease, specifically, we're talking about the vessels of your heart. So things like atherosclerosis, again, hard thing to say, but we're talking about, I know I didn't do that very well, but we're talking about buildup in the heart. Right. Now, when we look at those things, we look at family history, and family history can be so important in diagnosing things that are going on. We want to know, did mom or dad have this? Did grandma or grandpa have some kind of heart issue? Because it's not just your DNA, but we're looking at how you were raised. Right. You know, were you in a household where people smoked? Were you in a household where eating a steady diet of fast food? Did you live in an urban community or in a rural community? Because what you eat and how you live and how you behave and what you do are all affected by that, pollution, things like that. Sure. So it's really important to know if mom or dad, brothers or sisters, grandma and grandpa had any kind of heart or vascular disease.
Sure, so it's just really important to know the history and also to respect it.
Correct, absolutely,
Yep.
absolutely.
And I feel like too, like heart problems can be so sneaky, you know, come up without even expecting
they
it.
Can.
Right, but what are some signs and symptoms that people can look out for when it comes to cardiovascular disease?
So, like you said, that's why we call it the silent killer. People oftentimes, when I worked in an emergency room, they would come in and they didn't even know they were having, family would say, he's so healthy, he hasn't been to the doctor in years. And I thought, oh, yeah. But it can be. So chest discomfort, big one. If you're having chest pain of any kind, it may even feel like heartburn, you want to go in. Any kind of discomfort in the upper body. So, you know, we talk about neck, jaw, arms, but it could be anywhere in the upper body. Shortness of breath. Sometimes that's all patients have. They'll go, yeah, I was really short of breath. I didn't, and that was the start of their heart issue. So.
Gotcha.
Knowing the symptoms is super important.
So
and not dismissing it. I know many of us are afraid. We think, oh, if we go in, they're going to think we're crazy. If it's nothing, I'm going to feel foolish.
Right,
or
or
wasted
especially
money.
men, you know, just
right.
It's a thing. You know, guys often don't want to go to the doctor.
Correct.
So so just really paying attention to your body and those signs. Are there things that people can do to prevent a heart attack from happening?
So absolutely, making those changes. If you smoke, quitting smoking, I know I can't say that enough. Even cutting back on smoking, that nicotine is so dangerous to your blood vessels. Lowering your cholesterol intake, you know, maybe doing fish fries only once a month instead of every Friday. And lowering your blood pressure, taking your medication on a regular basis. Also with cholesterol, you know, we have statins now that you can take. It's so easy, and that helps take that bad cholesterol out of your vessels and into your liver where it can be processed. Right. So making those kind of changes, exercising, you know, working that heart and getting out there, just doing those extra laps when you go to Walmart around the store or inside Menards or Home Depot, you know, get up and just walk.
Yeah, it can make a world of a difference.
It can, absolutely.
Exactly.
And seeing your doctor on a regular basis.
Yes,
Sorry, you do want to do that too.
Absolutely, for sure. And we are running short on time, but you know, real quick, how can people get treatment for it too?
So definitely, if you're having those symptoms, go to the ER. Talk to your doctor about them. Again, we can do stress tests, EKGs, do different ultrasounds. We can do blood tests to see if you're actively having a heart attack. So having those follow-ups with your physician going into the emergency room are big things that you can do to preserve your life. And
Right. No, they're all good tips and good things to know too. Because again, silent killer, it can really sneak up with
Right.
no warning.
Right.
Exactly. Yeah, especially this month. You know, everybody's
Right.
paying
Heart
extra
health.
close attention to
That's
it. So,
right.
yeah, we appreciate you. Thanks so
So much
much.
for being here.
Yeah.